Welcome. I want to thank you for joining us to learn a little bit about diagnostic testing in the dental setting. I'm David Kochman, Vice President of Corporate Affairs at Henry Schein, and we're going to present you with an overview of diagnostic testing, what's involved, what you need to do to begin, and some products that are available for you to begin testing in your office. So right now we're talking about COVID because short term, there's an opportunity to help in the midst of this pandemic. But long-term, diagnostic testing can become a part of your dental practice. And certainly it's going to help continue that trend that already was underway of integrating oral health and overall medicine. So whether it's referred to as oral health and systemic wellness or the mouth-body connection, we know that oral health directly affects overall health. Certainly the data demonstrates a close correlation between periodontal disease and many of the leading NCDs, including cancer and diabetes. On top of that, we know that there are connections between oral health and Alzheimer's as well as heart disease. Diagnostic testing can help us to close that gap because basic diagnostic tests provide us with a ton of valuable information that can allow us to detect underlying diseases before they become an acute condition. For example, you can run A1C or lipids in your office very easily. And this is going to help us to detect diabetes or high cholesterol before it becomes an acute problem. Because providing education on prevention is a way for us to address these before they blow up into something that really becomes a large issue. By incorporating diagnostic testing as part of the basic prevention and wellness treatments that you already provide for your patients, we can help reduce the costs of care, improve patient outcomes, and otherwise lead to an overall healthier society. These diagnostic tests are not the only way to help bridge that oral health and systemic wellness gap, but they certainly are an efficient and effective way to do it. And they happen to be a timely one because right now, we really do need much more testing out there. Now, helping pioneer care improvement models has been something that Henry Schein has done for many years. In the 1980s, Henry Schein helped to introduce gloves to the dental practice in response to the AIDS epidemic. In the 1990s, we introduced Easy Dental, which became the first economically priced and widely used dental practice management software. And more recently, we played an early role in educating dentists on the importance of using digital imaging in their practices, including digital scanning to replace impression material. Notably, this was done in partnership with the American College of Prosthodontists, because when Henry Schein acts to help make these improvements, we do so in partnership with the profession and organized dentistry, each of whom are very supportive of diagnostic testing in the dental setting, I should add. The ADA, the ADSO, the AAPD, and other groups are voicing their support, lobbying, and encouraging their members to become engaged. Dental boards across the country are clarifying and solidifying the ability of dentists to conduct diagnostic testing and in some instances to perform vaccinations. And university partners are coming together to help develop protocols and education materials that can inform dental practices on how to best incorporate testing into their practices. So Henry Schein will continue to partner with the organized dentistry and with the profession to help support diagnostic testing. The dental office really is a natural environment to perform simple CLIA Waived diagnostic tests. Many patients visit their dentist more often than they visit their physician. The dental workflow allows for conducting the diagnostic test and returning results at the point of care. And of course, dentists are trusted members of the community, able to provide valuable information to patients and for patients to receive that information and trust it. So, in addition to the long-term potential of conducting diagnostic testing in the dental setting, right now in the middle of the pandemic, society really needs dentists' help. On vaccines, many state dental boards are evaluating expanding their scope of practice to allow dental professionals to perform those vaccinations. The trust that dentists share with patients could be invaluable to encourage critical mass of our society to actually take those vaccines. And on testing, we simply need more capacity. We need to leverage the full complement of our entire healthcare workforce to perform these tests. And dental team members are fully capable of and are best situated to perform these tests in many instances. Finally, many of these tests lend themselves quite easily to being performed in a dental setting, whether they be saliva-based or breath-based. Many of the new tests coming out certainly would fit quite well and harmoniously into a dental office. So there are some steps that you need to perform before you can conduct a diagnostic test in your office. But I want you to know that we validated the profession's interest. We conducted a survey of many of our customers, and the feedback was overwhelming that dentists are interested in learning more about this, and many are willing to go through this process of becoming CLIA certified. Many of the reasons given are for safety and peace of mind of both staff and patients, the convenience of being able to conduct a test at the point of care setting right when the patient is in the practice. And finally, that these tests are helping to lead dentists to make better decisions about how they're going to treat their patients. Henry Schein is here to support you along the way. We've prepared detailed informational guides. We have started a Facebook group that is intended for the profession to converse and to dialogue about what's going on and how are you incorporating a practice and how is this reimbursement going and what do you do in these scenarios. And we've developed a dedicated team to focus on supporting dental health professionals as they come along and incorporate this testing into their practices. So with that, let me introduce you to two such team members, Dana Becker, who is Henry Schein's diagnostic consultant, that will talk to you about how you're going to get started to conduct testing, and then we'll show you some of the products. And Dr. Ari Levy, who is our Henry Schein Senior Medical Advisor, that will talk to you a little bit about detecting the COVID virus and the immune response during various times along the disease state. I want to thank you for taking the time to join us and to learn about this, and for coming along this exciting journey of bringing diagnostic testing into the dental setting.
I'm Dana Becker. I'm a diagnostic consultant for Henry Schein, and I was brought on board to help develop a comprehensive program for dentists to begin doing diagnostic testing in their offices. I have a clinical background. I'm a medical technologist, and I worked in a hospital laboratory for many years before moving into an IVD industry of working with manufacturers that produce hematology, chemistry, immunoassay analyzers for the laboratory. I worked for companies such as Bayer Diagnostics, which is now Siemens, and they were focused more on the larger core laboratories, but had some business in the point of care as well. And then worked for Hariba Medical, which was primarily focused in the point of care arena for hematology and chemistry. And finally, a startup organization called Site Diagnostics that developed hematology for the point of care. So having worked in a wide variety of settings in the clinical market, I have spent much time with physicians and helping them begin testing in the physician office laboratories, which made working with dentists a seamless and easy transition, very similar type scenario. So this comprehensive program that we developed has all of the key elements involved in performing testing on site, and I'd like to take you through them. So Henry Schein developed a comprehensive program to assist dentists in getting up and going on COVID-19 testing in their offices. It's really a 6-step process, and I'll go into each one in more detail, but you can see here that the first step is applying for a CLIA license, and I'll explain what CLIA stands for in a moment. Also, the second step, setting up your testing environment. It's important to do good quality testing, and so we have a lot of information surrounding that aspect of the process. The third step is ordering or selecting the right test and the consumables that are involved with the testing process. And then, of course, administering the test, the protocols that you decide to use in your facility. And there's a lot of guidance that comes in play with that. And reporting test results. It is a requirement to report those COVID-19 test results, and each state has its own requirements. So we'll talk a little bit about that, as well as filing for reimbursement and billing. The FDA is an agency that you all recognize, and they're more involved in the manufacturing side of regulations. Each manufacturer has to go through an extensive process in order to get approved or cleared to sell their product in the market. It's a little bit different of a situation when you're talking about a pandemic. So the FDA has what's called emergency use authorization. And instead of approving or clearing the tests, they actually have an abbreviated format called emergency use authorization, EUA. And that's where you're going to see all of the COVID-19 tests that are on the market today. Amidst the pandemic, it can be challenging to go through the rigorous approval process that's normally required. So this abbreviated form allows manufacturers to produce results and submit minimal data that meets their requirements so that they can sell the product in the market. Another organization that you may be familiar with, or agency, is CMS. That's the Centers for Medicaid and Medicare Services. And they're really the organization that monitors and regulates testing in the laboratory or on site or in the offices. So they're making sure that quality testing is being performed and that all the rules and regulations are followed appropriately. And then finally, you may not be familiar with this particular term, but there's a term called CLIA. They're not an agency, but rather it's a legislative amendment. It's called the Clinical Laboratory Improvement Amendment. And that's really where you see the different regulations required for doing different levels of testing. There's actually 3 categories of CLIA certificates for testing. The first one is the waived certificate. That's the most simple and basic. And then, of course, you have the second one, which is moderate. Those are tests that are a little more tricky to perform and require more hands-on or interpretation. And finally, you have a classification called high complexity. And that's where you're doing very difficult, challenging, and complex tests that require a number of different steps as well as interpretation. So those are really the 3 levels. For our purposes, in doing testing in a dental office, it's required to have a CLIA waived certificate. And CLIA waived are tests that are, as I mentioned, really simple and basic tests that have a small risk of having an erroneous result. However, there still is that opportunity. So you have certain regulations and requirements to make sure that you're producing quality results. But the process itself is very simple. You need to fill out a CLIA application, and there's a number of different fields that have to be filled out. And then there is a cost associated. It's $180 for the CLIA waived certificate, and that lasts 2 years. If you wanted to continue doing testing beyond 2 years, you would pay an additional $180 fee. There's 2 main requirements when participating in a CLIA waived certificate. The first is assigning a director. And while there's no professional requirements or educational requirements associated with CLIA waived testing, it is important that the dentist picks someone to oversee the testing and making sure that things are done according to the manufacturer's guidelines. That's with the exception of a couple states that have their own regulations above and beyond CLIA, which is important if you're in one of those states that you follow all of the requirements of that state in addition to the CLIA waived certificate requirements. And the second requirement for CLIA waived certificate is actually following the manufacturer's guidelines without modification. So you can't decide not to do specific steps in the process. You need to follow those guidelines very carefully so that you are ensured of a good test result. Once you've applied for CLIA waived certificate, then you're going to get a number in the email that allows you to do testing. Typically, this is a several-month process. And with the expedited process under the pandemic, now states are issuing CLIA waived certificates within 10 days to 2 weeks. So it is a faster process. And again, once you have your CLIA number and you've paid your fee, you can begin testing on site. The second step in the process of doing testing on site is good laboratory practice. Henry Schein really wanted to provide a responsible way for our dentists to do testing. And while CLIA waived certificate doesn't require much, Other than, as we mentioned, a director assigned to oversee testing and following the manufacturer's guidelines, Henry Schein wants to offer additional guidance as far as how to run good quality testing on site. And that's based on good laboratory practices. The CMS and CDC have a lot of information that they've shared on how to do good quality testing. And it includes things like documenting your testing, your quality control procedures, as well as making sure that your operators are well trained and assessed regularly. So we provide a number of materials that allow you to follow along and make sure that you're actually performing good quality testing. The next step in the process is actually selecting the product, figuring out what your protocols are, and then actually performing the test. And again, the CDC and CMS provide a lot of information associated with that and have printouts and tools that we've added to our program for your access. There's checklists that allow you to question your patient and make sure that they are not at risk for COVID. There's examples of how to counsel the patient if they've gotten a test with you and they've received the result, whether it be positive or negative. And the manufacturers also provide guidance. Many of them provide tools that you hand the patient after the testing to guide them on what the test was for, what the results mean, and how you should move forward based on your test results. In addition, the ADA has stepped in and also provided guidance on how to open up safely in a dentist office, as well as testing guidance for those of you that are wanting to do testing in your office. And all these resources are available in the program that we've developed. The next step in the process is reporting. It is a federal requirement to report COVID test results, and each state is required to submit to the CDC. You, as a dentist performing testing in your office, are also required to report those results to your local Department of Health. And we have information on what to report, how to report, and when to report, depending on the state that you're in. It varies greatly. Some states require all positives and negatives to be reported. Some require positives with a log of your negative results, and also a time frame. Many states require 24-hour resulting, and others, like New York, for example, would require that you send in your positives within 3 hours. So we advise that you contact your local or state Department of Health to make sure that you're following the guidelines for your state appropriately. And finally, reimbursement. Right now, the ADA is projecting to release codes for dentists in 2021. Right now, they're for antigen and antibody testing, but we expect that they will also include molecular testing. But they advise to use medical billing in the interim. And many of our dentists are attempting to bill medical. This is not something that most dentists are familiar with, unless you're an oral surgeon and then perhaps you have done medical billing in the past. But we do provide codes. There are CPT codes available, as well as the new HCPCS code. And all of that information is available, as well as ICD-10 codes, which are for meaningful use. There's a code available as well for counseling. It's called E&M, and we provide that information as well. The verdict is really out right now as to how well the dentists are being reimbursed through medical billing. We know that they're not reimbursing for asymptomatic patients, and typically you wouldn't have symptomatic patients coming into your office, but asymptomatic patients could be reimbursed if they had an incidence where they perhaps had contact with a COVID positive person, or perhaps had other risk factors. For example, came from a hot spot or was traveling outside the country. Those may be reimbursed under specific codes. Most dentists are actually billing the patient outright. And you'll find that that varies amongst dentists, whether they're charging anywhere between $125 up to $250. And then they're suggesting that if the patient would like to be reimbursed, that they file a claim independently with their own medical carrier. So this discussion has been ongoing, and we created a Facebook group specific for dental practitioners so that they can discuss these questions and concerns and challenges that they're facing amongst their peers. And we have over 150 members of the Facebook group, and it's a real good opportunity for people to discuss what's happening and how they're utilizing protocols in their practice.
My name is Ari Levy. I'm an MD, MBA founder and CEO of Shift, which is a transformative approach to primary care health delivery. We are an organization that is Chicago-based, where we do three major things. We assess, we care, and we connect individuals and organizations to the resources that they need to build health in their daily life. We are here now talking to you about our response and our approach to caring for folks and supporting organizations during the COVID pandemic, our use of testing, and our understanding of the virus itself. So as we think about diagnostics, one of the what I call beauties of it is that technology has allowed us to simplify identifying varying diseases and get information that we need. And so when I think about our practice and I think about dental practices and I think about what is happening in terms of direct to consumer, we have both a responsibility and an opportunity to find seamless ways to integrate our practices to provide information, and point of care testing can allow us to do that. So when we think about testing for folks, we often want to think about and divide the categories into asymptomatic and symptomatic. Right now, all testing has been approved through FDA EUA for folks who are symptomatic. What we do know is that we do need to identify and diagnose individuals in the asymptomatic or screening perspective, because that allows us both to be able to ensure safe interventions, safe surgeries for folks who we need to care for and ensure that we're not spreading disease, as well as return to work and all of those strategies. When I think about how I want to test in my practice, what I often do is I think about, and you guys will see these slides come up on the screen, a testing overview, if you will, of understanding viral replication and the virus itself in each individual. As we take a look at this chart, what I want to point out are a few things. First, there's what we call the asymptomatic stage. There's the symptomatic stage, and then there's the immune response. And let's break these down. The asymptomatic stage, it's where you are not necessarily feeling anything, but you may still have, and as we know, you are likely to be able to shed the virus and infect others. Okay, and it's usually about 2 to 3 days before you begin having symptoms is when you're doing this viral shedding. Hence why we contact trace and say go back 2 to 3 days. Once you begin having symptoms, you move into the symptomatic stage. And that symptomatic stage can last on average, 7 to 21 days, why we often say usually about 2 weeks. In the symptomatic stage, you can be diagnosed. It's where the testing is most efficacious, and we've seen the FDA approvals. What we want to talk about is then the third stage, which is the body's immune response, okay, where the body mounts a response and you begin to have these IgM, IgG, antibodies, killer T cells, where the body is mounting its surge to fight against the disease. What often happens is that usually happens just a couple of days after the symptoms begin. So we say a couple of days, but usually about a week. So as we think about testing, we should break the categories down into molecular, antigen, and antibody. So we think about those three general categories. And when you think about molecular, you want to think about PCR-based testing, rapid NAT testing, or we call it RT-LAMP testing as well. And that identifies the viral RNA. And that viral RNA is what we see often in the earliest stages. It's the most sensitive and most specific. It is a often longer, bit more arduous process, takes a lot more time and can be a little bit more expensive. As we then move to the antigen testing, what you have with the antigen testing is that is a rapid diagnostic test, which identifies a protein code, which again is different than the virus's RNA, and is a little bit less sensitive and specific. However, in symptomatic and in screening populations, is an excellent tool for speed, accuracy, and precision. When you move to the antibody test, what you then have with the antibody test is you have a test which measures the body's immune response to the COVID virus. So let's talk about how these tests work. First of all, let's take the moleculars, and what we're going to do is we're going to break this down into a very simple manner. What you're doing is you collect the material, and then what you're doing is you're extracting the material, looking for the viral RNA, and it's a heating, reheating cycle that happens over and over, and that cycle takes time. And what it does is it amplifies that RNA, and that's why it is the most diagnostically accurate or sensitive and specific. When we think about the nucleic acid antigen test or LAMP test, those tend to be two tests which do the same basic premise. They just have it in a much shorter cycle time and window. So there's a heating and cooling process, but it does not happen in the same order of magnitude or number of times that a PCR test does. So why that's significant is that is a shorter time, but also decreases the accuracy and precision just a smidgen as compared to PCR based on what we understand with testing. What we have seen in the data, though, is that there are many good molecular tests, aka NAT testing, that is available and quite precise. For molecular testing, we have a couple of modalities of collection. We have anterior nasal swab. We have the nasal swab that many folks say go to your brain. So it's a deeper or anterior nasal pharyngeal swab. And then we have salivary based or saliva based collection. Those are the three main ways that we will collect for the molecular based tests. When we think about rapid antigen testing, that is a strip, if you will, that takes the sample, puts it on, and has various controls. And that happens in a shorter window of time. The control strips are meant to test positive for varying protein coats, whether it's antigen or antibody. So the rapid antigen test and the rapid antibody test work very similar. The modalities of collection are different. Those tests are trying to find a protein, either a protein coat or a protein match, to tell you whether the body has mounted a specific response, either the antigen response, or an antibody response, either an IgM or an IgG or other Ig proteins. But again, these tests are much more rapid and they have distinctive modalities of collection. First of all, I understand that there is no perfect test. So what we need to understand is who are we testing and what are we testing for? And if I am trying to put myself in your shoes as a dentist, I want to pay attention to, does my staff have it and are they spreading? So I want to make sure I'm screening and supporting my staff. And then are my patients, who I don't know where they're coming from and what their exposure risks are, do they have it and or are they spreading it? So first and foremost, what I think about is, do they have any symptoms or not? So symptomatic, asymptomatic. And then I begin thinking about what is the algorithm that I would like to go down, understanding the various performance metrics of the different testing. As I think about our patients, we think about take symptomatic versus asymptomatic out of the equation. Everybody that is actually coming in should be asymptomatic. Folks who are symptomatic need to first get tested before they could even come in to see us. For us, because we cannot be a source of viral spread. When I break this down, there are some considerations that we take into account and that I would suggest you guys take into account as well. One is cost, second is ease of use, third is what we call pre-analytical factors. So how easy, efficient, and effective is it to do it right repeatedly so that there's not an error rate. And then I also think about the accuracy and precision of the test, or the sensitivity and the specificity. So those are the things that we think about, and all of that is under the auspices of how many people do you have to get done in a given day, hour, etc. Let's talk about the testing availability and how they should be used as identified by the FDA and HHS. So PCR testing is considered the gold standard today. It is the test that if you are symptomatic, we request, the government and the regulatory bodies say is the most accurate and precise test. It also picks up folks who are asymptomatic because the viral RNA, as we discussed earlier, expresses itself a little sooner. Remember, this test costs more and takes longer to get done, and cannot be done in an outpatient setting, meaning it requires a lab or a higher level of what we call CLIA complexity in order to be administered and run. So this is done out of most institutions, or in the saliva-based collection, it has to be sent off to a lab to be reviewed. We do have, and what is happening now is molecular-based testing is being approved as tests that can be used at equivalent rates to the PCR test. And the reason being is that the sensitivity and specificity of those are very high. Now, not all of them are the same. We understand that there are different performance values for Q Health versus Abbott's ID Now, for example. And those tests are run a little bit more rapidly. We're talking about, minutes instead of hours. They do cost more, but provide a better throughput. When we think about the rapid antigen testing, the word that we often use is point of care test. The reason that it's point of care test is that it's CLIA waived. That means many of us can be taught and trained on how to do it, and it doesn't have to be run in a CLIA complex lab, which means that this is the test that gets used most often for screening as well as diagnosis in community, because the throughput is much faster. This test as well costs a little bit less money per test. And again, its accuracy and precision or sensitivity and specificity is a little bit lower. So PCR, molecular, nearly the same. Rapid point of care antigen testing, a little bit lower than that.
You just heard from Dr. Levy that there's a number of different types of tests available. Molecular tests, which test for the actual viral RNA. There's antigen tests, which test for the proteins that are on the virus, and antibody tests, which don't test for the virus, but rather the body's immune response to having been exposed to the virus. So Henry Schein selected a number of different products that were really conducive to testing at the point of care, and one of which is Q Health. Q Health is a company based in San Diego, California, and they designed a very simple, easy to use system that was designed originally for home use. So it's quite easy to train and get up and going on testing without a lot of technical difficulty or training involved. So I'd like to explain a little bit about the product and show it to you here today. So the system has a number of different components, one of which is the Q Health monitor. And I'll show it to you right here. The monitor is very small and compact. It's also portable. It can carry a charge for 10.5 hours. So you can move it to different areas within your practice and do testing. As long as while you're doing testing, it's on a stable, flat surface, not like I'm showing you right now. But it is a small device and it is very compact, and it's charged by USB-C charging system. And it also comes with COVID-19 test-specific cartridges. Okay, so this is the cartridge. It's very small and compact. And all you would need to do is insert the cartridge into the monitor, and the system will show you with track lights that it's begun working and warming up the cartridge. The reason it's warming up the cartridge is it uses isothermic amplification, which is a methodology equivalent and similar to PCR. And this is what's giving you those excellent results in sensitivity and specificity. So once the system is done warming in that 60-second cycle, it'll alert you that you can use the sample swab and begin collecting the patient sample. So the sample swab is very small. You can see it in front of you. It is an anterior nasal swab, not one of those nasopharyngeal swabs that go all the way back to your brain. This only goes about an inch into each nostril, and you would insert it into the nostril, rim the inside of the nostril 5 times on each side. And then when you were finished collecting, you would insert it into the cartridge, which is already in the Q Health monitor, and the test would begin. Takes about 20 minutes from time to result, and then the test is complete. It's a qualitative result. So you're actually not getting a number, but rather a positive or negative answer. And those results would be transferred by Bluetooth over to an iPhone. The system's operating system is actually an iPhone 8 or higher with iOS 13 or higher. And you would load the Q Health app onto your iPhone, and you would receive those results that way. And you can see in front of you on the slide that there's some examples of the Q Health app data fields. The Q Health app is HIPAA compliant and encrypted data, so your data is secure. And once the results are transferred over by Bluetooth, you can print, email, or text those results like you would any other PDF off of an iPhone. And the nice thing about this system is it is so easy to use. Everyone knows how to use an iPhone, and the analyzer and the components themselves are also very simple and easy instructions to follow. Let's talk a little bit about the cost of the system. So the cost of the monitor is $400. And a lot of people get more than one monitor because it does just do one test at a time, each test taking 20 minutes. So if you have a large patient flow, you would want to potentially have a second monitor or multiple monitors. You can put up to 6 monitors onto one iPhone. So that's kind of neat as well. The cartridges are $90 a piece. It's one cartridge for patient use for each patient. And so they come in boxes of 10. So a box of 10 tests would then be $900. And the patient sample swab is included in that package. There is an additional product that comes with the system, and that's called the QC or quality control swabs. They come in packages of 6. There's 3 sets of positive and negative controls. And the reason you would use quality control are 3 circumstances, really. The first one is when you're training the operator for the first time, they would be required to follow the manufacturer's guidelines without modification, and then perform a positive and negative swab. The positive and negative swabs are used with the test cartridges. That ensures that the tests that you're using on your patients are working properly and correctly. The second circumstance where you would use quality control is if you have a change in lot number. Manufacturers make reagents and cartridges in lots, and you may consider them batches. Each lot is assigned a number, and when you would order your product, you would get in a specific lot number. The next time you order, you may perhaps have a different lot number, which then would require you to do a positive and a negative control swab with that cartridge. And then finally, the third circumstance where you would use quality control is if you suspected something was wrong. Let's say all of your patients are coming up positive, or all your staff members are coming up positive. You might be a bit suspicious. So you could always test to make sure your test system was working properly by just doing the quality control swabs and entering them into the system. Those quality control swabs are $175 for those 3 sets of positive and negative controls. The Q Health system, as you've seen, is very easy and simple to use. And I'd like to show you a video that demonstrates its utility in a variety of different settings. This being an example, the NBA has selected Q Health as their partner for COVID testing. So enjoy the video.
We need a more rapid solution. If someone needs to come here today to do some work, whether it's a specialist or someone who's working routinely, we have a test that can give us an answer whether or not it's safe to allow them to come to be in the bubble.
CLIA's product from sample to result it's an incredible device in that regard. So that kind of testing, we think in the future when we're not in a bubble, will help us get back to work more normally. So one of the great things about Q is that it's an easy test to deploy anywhere. It's not focused here on players or team staff. We're actually using it on the hotel staff who are helping keep this event running. We've worked with the Orange County Division of Florida Health and made Q Test available to help testing in the community.
To be able to run a test, have the results real time on a dashboard on your phone, that's fantastic.
I think not just for the NBA, but for society, point of care testing, this is how we're going to get back more to normal. Q's product from sample to result it's an incredible device. Hopefully will be a test that people can use at home in the near future.
When we started, the goal was to transform how we interact with our health. And now, more than ever, it is necessary to have a powerful solution that harnesses the science, pushes the boundaries, to scale the manufacturing, to deliver more than a test, to deploy an antivirus system with a simple cartridge and swab process. Our molecular test amplifies the genetic materials to detect the virus, to protect you, your team, our frontline workers, and our families, so that together we can get through this with Q.
We have another test available shortly. We expect or anticipate that we will have availability of the BD Veritor system in late December, early January, and that is an antigen test. So a little bit different than the molecular test. You give up a little bit of the sensitivity when using an antigen test versus a molecular, but it also is a little bit faster and about half the price. So for your purposes, you may find that that's an acceptable sacrifice. The BD Veritor system is also very simple and easy to use. It actually uses chromatographic immunoassay, and it gives you a qualitative result on the proteins that it detects on the virus. The cool thing about BD Veritor is that you have two options. You can either do tests in a singular fashion like you would with Q Health, or they also have a batch mode where you can do multiple patients at one time. So that may be something that's of interest to our dentists. The quality control material is also available by BD, but it is included as opposed to an additional cost. And when you talk about the performance of the assay, the sensitivity is a little bit lower, as we discussed. It's 84% versus the 99% you would see with Q Health. And it does have a very high specificity at 99.5. I kind of outlined here from their product materials how the system works. And we also have a video that we'll show you shortly that takes you through the testing process. But it does involve a couple of steps of sample preparation, a little bit more than perhaps Q Health, but still a very simple process and can be done easily by your staff. Let's go to the video and see the product in the works.
Ease of use, reliable results, simplicity. That's the diagnostic experience using the BD Veritor Plus system. You may know our BD Veritor portable analyzer as a state-of-the-art point-of-care system used to test for flu or strep. Now, that same system can be used for rapid detection of SARS-CoV-2 COVID-19 antigens, providing results in 15 minutes. The antigen detection kit includes swabs to perform a dual nares nasal sample collection. The Analyze Now workflow is the same as the original BD Veritor reader. The patient specimen is prepared according to the BD Veritor assay product package insert instructions. The assay timing step is completed prior to inserting the test device for interpretation by the analyzer. Now we'll do a simulated walk-away test. Power on the analyzer. When Insert Test Device or double-click button for walk-away mode appears in the display window, double-click the power button. You'll be reminded to connect the external power if the analyzer is not already plugged in. This is a requirement for walk-away mode. Make sure the instrument is resting on a level surface. A 3-minute countdown timer will be displayed on the LCD screen indicating the time available to prepare the patient sample. The test device may be inserted any time during these 3 minutes. When the sample is prepared, add 3 drops of the processed patient specimen to the test device sample well and immediately insert the test device fully into the test device slot. A distinct click indicates when the test device is fully inserted. A countdown timer appears on the LCD screen indicating the assay incubation period. Depending upon the type of test, the countdown will take from 5 to 10 minutes. After completion of the countdown, test results are read, analyzed, and displayed in a few seconds. The test result remains on the display screen as long as the test device is in the instrument or until the auto-off period is reached, either 15 minutes on battery power or 1 hour with the power adapter plugged in. Make sure to record the test result before removing the test device. The BD Veritor Plus system for rapid detection of SARS-CoV-2 assay is just one of the ways BD has responded to critical health needs related to the global pandemic. Visit bd.com/COVID-19 to learn more.
Let's talk about the BD antigen pricing. Similar to Q Health, there's no contract involved or commitment by the customer in order to utilize the product. And the cost of the analyzer is similar to Q Health as well, being $400 for each instrument. The tests come in packages of 30, and they're about half the price of the Q Health system test cartridges at $35, more or less. The quality control is also included, which is a little bit different as well. And we expect to have access to the product in late December, early January.
So if I step back and I think about testing and the testing landscape and the pandemic over the last, 8-9 months, I think the most important thing is about detection and identification. Treatment should be done by the clinicians, but from a detection standpoint, many of us can be doing this so long as the proper processes are followed. And the diagnostic difficulty here is not high. We are well trained, and you are well trained as your staff is. You've gone through higher degrees of clinical education where this is something that can be done, and quite honestly, I feel should be done in order to help us identify, triage, and then treat the disease so that we can get our arms around this.
So I hope that you've enjoyed learning about how you can bring diagnostic testing into your dental practice and some of the products that Henry Schein has available for you to use at the point of care. In addition to those point of care solutions, Henry Schein also has available a lab-based workflow. This is with a saliva collection where the collection sample is sent into a lab and a molecular PCR test is run with results given to you fairly rapidly. In any of these instances, if you're interested in learning more, please reach out to us at dentaldx@henryschein.com. That's dentaldx@henryschein.com. And finally, I would be remiss not to mention Henry Schein's Wearing is Caring campaign, which is promoting the importance of wearing masks to protect yourself and, equally important, to protect society. I'm going to ask folks to put the link up here and really would encourage you to go on and to participate in this campaign that we're doing in partnership with the UPS Foundation. Thank you for joining us. Thank you for your trust. And thank you for allowing us to be your partner in providing care to your patients.